Good morning, afternoon, and evening, everybody. Welcome back to today's BRAVES'S Podcast. My name is Chanel, and how are you guys doing today? Today, we are going to be talking about Alice in Wonderland syndrome. You might wonder, isn't Alice in Wonderland a movie? How can that relate to a mental health issue? That's probably cap. But Alice in Wonderland syndrome is a rare condition that disrupts your brain's ability to process sensory inputs. These syndromes will affect how you perceive the size of things you see around you, the feel or the look of your body, or even both. This condition can also distort your sense of reality. It can also affect the body's schema and the experience of time. Alice in Wonderland syndrome is rare because fewer than 170 cases have been documented, which means it can be divided into a mean number of 1.1 cases per year. The name for this syndrome was first described in 1952. A young patient suffering from schizophrenia said that she felt just like Alice in Wonderland because of her sensation of shrinking and enlarging. Some symptoms of Alice in Wonderland syndrome might include change in size, change in distance, changes in both size and space. People appear more minor than they actually are, changes in objects' appearance, and the loss of track of time. Alice in Wonderland is mostly caused by bacterial infections. It can also be affected by abnormal amount of electrical activity resulting in abnormal blood flow in the parts of the brain that process visual persistence and the texture. Other than that, it can also be caused by certain types of strokes, mental health conditions such as depressive disorder, medication, recreation drugs, and inhaled. The syndrome primarily affects children and young adults. Research shows that nearly 2/3 of the cases happen in people that are under 18. Even though this is a rare condition, unlike the others, the duration of symptoms of Alice in Wonderland syndrome tends to be short, mainly on the order of minutes to days, but these symptoms may also last for years and even for a lifetime. A person suffering from the disorder may have hallucinations several times during the day and manifestations that may take some time to subside. Justly, the individual might get terrified, anxious, and panic-stricken. Now you might wonder, other than those eye-seeing symptoms from the patient, how can people get tested? The most likely test for Alice in Wonderland symptoms might include imaging tests. This test helps look for instructional changes or other issues in your brain that might cause Alice in Wonderland syndrome. Doctors also use spinal tap, which tests your cerebrospinal fluid, also known as CSF, which surrounds your brain and spinal cord, cushioning them as you move. Lab tests can also help for signs of infection in your CSF. The most common way to treat Alice in Wonderland syndrome is by treating whatever is causing it. Because of that, there are visions of methods of treatment that might help Alice in Wonderland syndrome. Your healthcare provider is the best person to recommend treatments that might help. They can tailor the information to your specific conditions, need, and circumstances. They can also advise you on the possible side effects or complications that you might have and what you cannot limit or prevent them. After hearing all that, some of you might wonder if there are some ways to prevent this. Alice in Wonderland syndrome might happen unpredictably and for reasons that experts still don't fully understand. Because of that, it is really impossible to prevent it. Many of the conditions that cause it aren't preventable, and there are not limited or no ways to reduce your chance of developing this syndrome. Fortunately, this condition is also rare, and when it does happen, it usually temporarily and goes away quickly. But you should get emergency medical care help. If you have Alice in Wonderland syndrome and stroke symptoms, you should also get immediate medical care if you have a fever or other signs of brain or nervous system related infections, which includes personality changes, problems speaking or moving, and losing consciousness unexpectedly, especially when it's difficult or impossible for somebody to wake you back up. A not so fun fact about this syndrome that I found was that the author of Alice Adventure in Wonderland, Lewis Carroll, himself may have Alice in Wonderland syndrome, where the book was influenced by his own experience of migraine in writing the book. Now that's it for today's Brave Podcast. Thank you for listening. If you need help, our staff is always here to listen. Thank you for listening and have a great day. Bye.